Did you know that something as simple as not drinking enough water could be quietly damaging your kidneys, your brain, your joints, and even your skin right now, today? Most people think dehydration means feeling thirsty. But by the time you feel thirsty, your body is already behind. And the damage from chronic low-grade dehydration builds up slowly in ways most people never connect to something as basic as water. Today we are going to talk about what water actually does inside your body, what happens when you do not drink enough, and which diseases can be prevented or even reversed just by drinking the right amount every day. We will also cover the surprising signs of dehydration that most people completely miss, how much water you should actually be drinking based on your weight and age, and yes, we will talk about what happens if you drink too much water, because that is a real risk too. This is going to be one of those videos that sticks with you. Water is one of the cheapest, most powerful tools for your health, and most of us are not using it right. If you have ever wondered whether you are drinking enough water, or if you have noticed you feel foggy, tired, or achy more than you should, drop a comment below right now and let me know. I would love to hear from you. Let us get into it. Here is something that might surprise you. Between 60 and 70% of the human body is made up of water. In women, that number is slightly lower, closer to 55%, because fat tissue holds less water than muscle does. That means water is the single most abundant substance in your entire body, more than anything else, and that tells you everything you need to know about how important it is. But here is the thing, more is not always better. Drinking too much water can actually be dangerous, and we will get to that. First, let us talk about everything water does for you. Starting right at the beginning, your mouth. Water helps your body produce saliva. Saliva is not just there to keep your mouth comfortable. It starts the digestion process, helps break down food, and actually protects your teeth from cavities. When you are not drinking enough, your mouth gets dry, bacteria build up faster, and your dental health suffers. Simple as that. Now let us move to your joints. About 80% of your joint cartilage is made of water. That includes the discs in your spine, which act like shock absorbers for every step you take, every time you bend or lift. When those discs are well hydrated, they do their job. When they are not, you feel it. In your knees, your hips, your lower back. If you have been dealing with joint pain that does not seem to have a clear cause, chronic dehydration might be playing a bigger role than you realize. Water also regulates your body temperature. When you get hot, you sweat, and that sweat cools you down. But if you are dehydrated, that cooling system does not work as well. You become less able to handle heat, which becomes especially dangerous as we get older because our sense of thirst actually decreases with age. Now let us talk about your blood. Your blood is more than 90% water. And your blood is the delivery system for everything your body needs. Oxygen, glucose, nutrients, all of it travels through your bloodstream to every single cell in your body. When you are dehydrated, that delivery system slows down. Your cells do not get what they need, and you feel the effects everywhere. What about your skin? This one matters to a lot of people, and for good reason. Well-hydrated skin looks plumper, smoother, and more vibrant. Dehydration makes skin look dull, dry, and more wrinkled. Lines and creases form earlier than they should. Dark circles under the eyes become more noticeable. If you want your skin to look its best, no cream or lotion is going to do what consistent hydration does from the inside out. And your brain? This is a big one, especially as we get older. Water plays a direct role in how your brain functions. It supports the production of neurotransmitters, the chemical messengers your brain uses to think, remember, and regulate your mood. Even mild dehydration, losing just a small percentage of your body's water, can reduce your mental energy, slow your thinking, affect your short-term memory, your ability to concentrate, and even your emotional balance. A lot of people go through their days feeling foggy, forgetful, or emotionally flat without realizing that they are simply not drinking enough water. This is especially common in older adults because as we age, our thirst signals become less reliable. You may not feel particularly thirsty, but your brain is still running on low. Moderate dehydration can cause disorientation and real mental confusion. If you or someone you love has been experiencing unexplained cognitive changes, hydration is worth looking at seriously. Your digestive system needs water too. Without enough of it, digestion slows down, constipation becomes a problem, and stomach acid becomes more concentrated, increasing the risk of heartburn, acid reflux, and over time, ulcers. Your kidneys depend on water more than almost any other organ. Their job is to filter your blood, remove waste products, and produce urine. Without enough water, they cannot do that job properly. Toxins build up, kidney stones become more likely, and over time, serious kidney damage can occur. Even your lungs and airways need water. They rely on moisture to produce the protective mucus lining that keeps your airways healthy. If you are chronically dehydrated, asthma symptoms and seasonal allergies can get significantly worse. And for your muscles, water improves muscle performance and endurance. Studies show that dehydration reduces muscle efficiency in activities lasting more than 30 minutes. Losing even 2% of your body's water content can noticeably affect your physical performance. Elite athletes can lose between 5 and 10% through sweat alone during intense training, which leads to fatigue, slower recovery, and reduced motivation. Water also supports a healthy weight. It boosts metabolism slightly and, importantly, it helps you feel full. Many times when we think we are hungry, we are actually just thirsty. Drinking a glass of water before meals can reduce how much you eat without any effort at all. So now the question everyone wants answered. How much water should you actually be drinking each day? You have probably heard 2 liters or 8 glasses. But the real answer is more personal than that. A general guideline that works well for most adults is about 30 to 35 milliliters of water per kilogram of body weight per day. If you weigh around 155 pounds, that is about 70 kilograms, you would need roughly 2,100 to 2,500 milliliters of water per day under normal conditions. Normal conditions meaning you are not doing intense exercise, the weather is not extremely hot or dry, you are not sick with vomiting or diarrhea, and you are not taking medications like diuretics that increase fluid loss. If you are younger and more active, you may need closer to 40 milliliters per kilogram. If you are older or have certain health conditions like heart failure or kidney disease, your doctor may recommend less, sometimes as low as 20 to 25 milliliters per kilogram. Always check with your healthcare provider if you have any of those conditions. For most healthy adults, 30 to 35 milliliters per kilogram per day is a solid target that will keep you well hydrated without overdoing it. Now, how do you know if you are already dehydrated? The signs are not always what you expect. The obvious ones first. You feel thirsty. Your urine is dark yellow or amber instead of pale yellow. You feel tired or dizzy. You notice some mental fog or confusion. Here is something important to understand. By the time you feel thirsty, you are already dehydrated. Thirst is not an early warning signal. It is your body telling you the tank is already running low. This is especially true for people over 60, whose thirst response naturally becomes less sensitive with age. But here are the signs most people never connect to dehydration. Bad breath. When your mouth is dry, saliva production drops and bacteria that cause odor multiply faster. Have you ever noticed that your breath is worse in the morning? That is because your body produces less saliva while you sleep, leaving you mildly dehydrated when you wake up. Dry or dull skin that does not bounce back quickly. If you gently pinch the skin on the back of your hand and it takes a moment to return to normal instead of snapping back right away, that is a classic sign of dehydration. Headaches. A surprising number of headaches, including migraine attacks, are triggered by dehydration. Even mild fluid loss can cause the brain to temporarily contract slightly, pulling away from the skull and triggering pain. A study involving younger women found that those who consistently drank more water had significantly fewer headaches overall. Muscle cramps. Dehydration disrupts the balance of electrolytes like sodium, potassium, calcium, and magnesium in your body. That imbalance can cause your muscles to cramp, especially during or after physical activity or exposure to heat. Increased cravings for sugar and a tendency to overeat. When your body is low on fluids, it can send signals that feel like hunger, especially cravings for sweet or salty foods. Many people reach for a snack when what they actually need is a glass of water. Now let us address a question a lot of people have. Can you drink too much water? Is that actually dangerous? Yes, it is. Everything has a limit, and water is no exception. Drinking an excessive amount of water, especially in a short period of time, can lead to a condition called water intoxication or hyponatremia, which means the sodium level in your blood drops too low. When that happens, water moves into your cells and causes them to swell. In the brain, that swelling can become life-threatening. A study published in the New England Journal of Medicine found that more than 13% of runners who finished the Boston Marathon showed signs of hyponatremia, caused not by dehydration, but by overhydrating with plain water during the race. Symptoms of water intoxication include nausea, vomiting, confusion, and in severe cases, seizures and loss of consciousness. This is most likely to happen during prolonged intense exercise when someone drinks large amounts of plain water without replacing electrolytes, The solution is not to drink less. It is to stay within the recommended range, and during long workouts or hot weather, consider a drink that contains sodium, like a low-sugar electrolyte beverage. For everyday life, if you are staying within the 30 to 35 milliliters per kilogram guideline, you're not at risk. Just do not try to drink a day's worth of water all at once. One more topic worth covering: drinking water first thing in the morning. While you sleep, your body keeps working. You lose fluid through breathing through the skin, and if you snore, even more so. By the time you wake up, you are in a mild state of dehydration almost every single morning. Starting your day with water, before coffee, before food, before anything else, is one of the simplest habits you can build for your health. Room temperature water works best. Not sparkling, not flavored, just plain water. Aim for at least one full glass when you wake up and work up from there if you can. Many people who build this habit report feeling more alert in the morning, thinking more clearly, and having more consistent energy throughout the day. Coffee is fine, enjoy it. But coffee has a mild diuretic effect, meaning it encourages your kidneys to release more fluid. That is not a reason to give up coffee, but it is a reason to make sure you are also drinking plain water throughout the day to compensate. Now let us talk about the specific diseases that water can help prevent, and in some cases help reverse. Acute kidney injury. One of the most common causes of sudden kidney failure is simply not drinking enough. When the kidneys do not have enough water to filter the blood, waste products build up and the tissue starts to suffer. Increasing fluid intake is often the first and most important step in recovery and prevention. Urinary tract infections. When you drink enough water and urinate regularly, you flush out bacteria before they have a chance to multiply and cause an infection. If you are prone to bladder infections, increasing your water intake is one of the most evidence-backed things you can do to reduce how often they happen. Kidney stones. Regardless of the type of stone, staying well hydrated is the single most effective way to prevent them from forming. Water keeps minerals diluted in the urine so they cannot crystallize and clump together. If you have had a kidney stone before, you know how painful they are. Drinking enough water every day is the best prevention there is. Gout and high uric acid. Very similar to kidney stones. When you drink enough water, your kidneys excrete uric acid more efficiently, preventing it from building up and forming crystals in your joints. Gout attacks are extraordinarily painful. Staying hydrated is one of the best tools for managing the condition. Chronic headaches and migraines. As mentioned earlier, dehydration is a well-documented trigger for both tension headaches and migraines. Making hydration a consistent habit, not just drinking more when you already have a headache, can meaningfully reduce how often they happen. And now, the serious complications of long-term dehydration that most people do not think about until it is too late. Chronic kidney damage and kidney failure. Years of inadequate hydration can permanently damage kidney tissue, leading to chronic kidney disease and eventually the need for dialysis. This is not a rare outcome. It is one that develops quietly without warning until it becomes a crisis. Seizures. The electrolyte imbalances caused by dehydration, particularly shifts in sodium and potassium, can disrupt the electrical signals in the nervous system and increase the risk of seizures, even in people with no prior history. Heat-related illness. Your body's cooling system runs on water. When you are dehydrated in hot weather, your ability to regulate your internal temperature breaks down. This can progress from heat cramps to heat exhaustion to heat stroke, which can be fatal. This is not a distant risk. Heat-related deaths are increasing every year, particularly among older adults who may not realize how quickly their body is losing fluid. Hypovolemic shock. In severe cases of dehydration, blood volume drops low enough that the heart cannot pump effectively, blood pressure falls dangerously, and organs begin to fail. This is a medical emergency. So what are some practical steps you can take starting today? Track what you drink. Most people genuinely underestimate how little water they consume. Count your glasses, use a marked water bottle, or download one of the many free hydration tracking apps available on any smartphone. If you are not measuring it, you are probably not hitting your target. Start your morning with water. Before coffee, before breakfast, a full glass of plain water. It sets a positive tone for the rest of the day. If plain water feels boring to you, make it more interesting. Add a slice of lemon or orange. Drop in a sprig of fresh mint or a cinnamon stick. A few cucumber slices. These small additions make a real difference in whether people actually drink enough throughout the day. Do not substitute soda. Even diet or zero sugar versions, they're for water. They are not the same. Water is what your body is built to run on. It is also far cheaper than almost any other beverage you could choose. Avoid drinking large amounts of water right before bed. A small sip if your mouth is dry is fine, but drinking a full glass late at night will likely wake you up and disrupt your sleep. And broken sleep has its own health consequences. And if you have any health conditions, especially heart failure, kidney disease, or are taking diuretic medications, talk to your doctor about the right amount of water for your specific situation. The general guidelines are a starting point, but your needs may be different. Water is one of the most powerful, most accessible, and most underestimated tools for your health. It does not cost much. It does not require a prescription. And the benefits for your brain, your joints, your kidneys, your skin, your energy, your mood are real and proven. The question is just whether you are using it. So here is what I want you to do right now. Before this video ends, go get a glass of water. And then come back and tell me in the comments, how much water do you usually drink each day? Do you think you are getting enough? And where in the country are you watching from? I read every single comment, and I would genuinely love to hear from you. If this video gave you something useful, share it with someone you care about. A friend, a family member, a neighbor. Most people around us are not drinking enough water and do not know what it is costing them. Sharing this could make a real difference for someone in your life. Take care of yourself and drink your water.